Hello ladies and welcome back. I'm here with Amalia at the Cosmetic Center. It's been a week of her recovery, right Amalia?
Yes.
Okay, I'm going to translate because we have a lot of Spanish speakers up there that they're always sending us messages. They only speak Spanish. And so, I'm going to translate. Buenos días, ¿cómo están todos? Estamos aquí en Bob Cosmetic Center con Amalia, que ya hace una semana de su recién operación de BBL, de transferencia de grasa a su glúteo. ¿Verdad, Amalia?
Sí.
¿Cómo te sientes, Amalia?
Bien, ya me siento nuevo, pero quiero ponerme una ropa y salir para la calle.
Ladies, Amalia tuvo su cirugía hace una semana, se hizo transferencia de grasa a su área gluteal con el doctor Osako Molepo. Sí, señores. Transferencia de grasa a su glúteo hace una semana y está caminando. Si ven los videos anteriores pueden apreciar que Amalia el mismo día estaba caminando. Fuimos a Recovery House, la llevamos en nuestro van de Recovery House, la seguimos en sus masajes, conocimos a su mamá, conocimos a su novio. Amalia también es mi amiga, no solamente es una paciente aquí muy querida. Amalia también ha trabajado como coordinadora en nuestro centro. Ella sabe todo lo que es recuperarse y ha vivido junto conmigo los pacientes recuperándose y día tras día de estos pacientes. Más o menos Amalia estaba bien, ¿cómo se dice? Informada en todo esto. So once again, ladies, we're here at the Cosmetic Center with Amalia. It's been 7 days after her surgery. She had surgery here at the Cosmetic Center with Dr. Osako Molepo. She had a Brazilian butt lift or a fat transfer, like a lot of people know. So, Amalia, quiero enseñar a los pacientes más o menos rapidito. Amalia todavía está hinchada, recuerden, hace 7 días, y esto lo vuelvo a poner a Amalia. Hace 7 días de este procedimiento, solo está hinchada. Como ven, ahorita les voy a traer la foto para volverles a enseñar la foto de antes. So, si mi camarógrafo ahí, Dairon, puedes bajar ahí abajo a buscar mi teléfono para poderles enseñar las fotos de antes. Rapidito, Amalia, así para que... Estoy loca por irme en bikini contigo. Nos vamos a ir en bikini las dos y nos van a seguir en bikini las dos ahí abajo. Amalia todavía está un poquito hinchada aquí, como pueden apreciar, en los lados.
En la espalda.
En la espalda, pero...
Todo es que hacer los masajes.
Amalia, te voy a hacer así.
Oh,
It hurts, ladies. Pero I'm sure todo el mundo te quiere hacer eso, ¿verdad que sí?
No, pero vamos a esperar todavía para eso.
Sí, no, yo sé. Recuérdense, es muy importante los masajes. Amalia se está haciendo sus masajes todos los días. Muy importante caminar, tomar un galón de agua diario. También es muy importante seguir una dieta, porque no porque te hiciste esto ahora, vas a hacer como tú me hacías antes, pollo tropical, McDonald's, helado, chocolate. Aunque yo no sigo las reglas nunca, pero Amalia es muy importante.
Estaba aprovechando antes de la cirugía, pero sí es muy importante que la cirugía es el primer paso.
Sí.
Después de la cirugía vienen tus masajes, viene la dieta.
Bueno, no estoy de acuerdo contigo. El primer paso es estar saludable.
Bueno,
sí. El primer paso, lady, es estar saludable, no tomar café, no tomar aspirina, no fumar. Hi, doctor. Aquí tenemos al doctor Osako Molepo.
Oh, you're filming.
Sí, I am, doctor. Aquí tenemos el protagonista de todo esto, Journey con Amalia. Él fue el diseñador de este cuerpo tan espectacular que hay abajo bajó Dairon a buscarme mi teléfono para poderles enseñar el antes de Amalia. Hi doctor, how are you? I'm doing this in Spanish because we have a lot of Spanish patients that want to know about Amalia. As you know, it's been a week after surgery. I don't know if you want to show her around, I already did, but if you want to explain anything.
Yeah, no, she looks amazing. Her tummy nice and flat, I think.
You can turn around. You can explain to the patient.
Yeah, sure. What's most important really for BBL is making sure that the liposuction turns out great. I think liposuction is the 80% of the operation, really making sure that the liposuction is successful, meaning that the stomach is very flat, like you can see here, and the waist is really small. It's been 1 week, right?
1 week.
7 days, doctor, yeah.
It's very normal to have some bruising like she has here in 1 week, and it typically takes about 6 weeks up to 3 months for all the swelling and bruising to go away. So she looks exactly how she's supposed to at 1 week. So spectacular. Mind if I turn around?
Yeah. Once again, ladies, this is the before of Amalia. I'm going to show it to you guys.
And yeah, she looks great. Perfect. Turn around.
I'm going to show you the after.
Yeah, very good.
After the same day. This is the after of the same day of the surgery. This is under.
Yeah.
And once again, we're here at Bud Cosmetic Center with Dr. Osako Molepo. And what's the number here, Amalia?
305-774-6151.
Remember, book your next surgery with this amazing Dr. Osaka Molepo.
Okay, great.
So doctor, what are we were telling the patient that the number one thing to start doing this journey with a surgery is health, no drugs. So can you tell us about
I mean,
that?
like, you have to be a good candidate for the operation. So you have to be well controlled. If you have a blood pressure problem, they have to be well controlled. If you have diabetes, that should be well controlled. But generally speaking, we prefer to operate on patients that are healthy and don't have any severe medical issues.
And BMI, doctor.
Right, and there are certain weight requirements, and so, you know, there are risks with surgery, anesthesia risk and surgical risks, and so we try to minimize that by not operating on people that are morbidly obese. So the BMI, called the body mass index, it's a ratio of your height and weight, and normal BMI is anywhere between 18 and say 35. Now, between 18 and 25, you're very thin. But between 25 and 35, that's a good range for you to be a good candidate for BBL. So nothing higher than 35, generally speaking, though, in outpatient surgery.
I'm gonna send Amalia to change. I want the patients to see how you look with clothes already, and it's only been 7 days before we put the garment. In the meantime, me and the doctor, we're gonna. If you need help, please just call my name. So doctor, let's just talk more about surgery, about BBLs, tummy tuck, and...
Yeah, sure. BBL is super popular down here in Miami. I'm good at it.
Not only in Miami, doctor.
Everywhere.
Everywhere. They're coming to Florida, actually.
They're coming to Miami. I think most of the plastic surgeons that have a lot of experience are usually in Miami or Los Angeles, but usually the coasts. So we do have a lot of patients from all over the country, all over the world, in fact, coming down here for BBL, Brazilian butt lifts, and tummy tucks, and all the other cosmetic surgery.
I want the patients to know that we do have a waiting list. We have patients that have been waiting for Dr. Osaka Molepo for the past 6 months, so it's getting pretty booked out. So call us and book your surgery before we run out of space. Thank you.
Yeah, and availability. Yeah, we're coming up on a really busy time of the year, usually from January till June, just
not stopping. No.
So now's the time to book.
Now is the time to book. Doctor, what about, I have a lot of patients that they want to do combo at the same time. They want to do tummy tuck and BBL at the same time. What do you recommend of that?
I mean, a lot of patients do want, you know, I think it's a culture. Everybody wants everything immediately. And, but usually it's best to separate these operations. Hey, let's pick you up.
This is just a really quick because she needs to wear her garment, but I want to see, it's only been 7 days, and this is how Amalia looks. Amalia, I'm gonna spank you again.
No, please.
Yeah, it's beautiful.
She looks
I think what's important is that the rolls that you had on the back underneath the bra.
She did that. I'm gonna show them
gone.
again.
And you know, she was in good shape. She had a nice shape already. It's just accentuating it and making it spectacular. So the rolls are gone. The tummy's flatter. The waist is smaller.
See the rolls, and then we're gonna see Amalia again.
And remember, this is only 1 week.
And she's still swollen, right, doctor?
This is actually, she's as swollen as she's going to be. The swelling actually gets worse for 1 week before it starts to get better. So you're seeing Amalia at her quote-unquote worst. It's only going to continue to improve over the next month.
And you see now no rolls. Well, you can see her now too. And this pictures, ladies, there's nothing in the picture done. It's the original picture.
Okay. So it's very important that you wear the girdle for at least 6 weeks. So we're gonna have Amalia get back in your girdle.
Yes,
okay?
and I want to show you everything that you have to put on.
You gotta wear the girdle all the time. The faja.
I'm gonna leave you here 1 second, doctor.
Yeah, it's very important that you wear the faja as much as possible for the first minimum 6 weeks. Underneath the faja, which is also very important, there are going to be some pads, some lipofoam pads. These pads are very important, making sure your skin is nice and flat and smooth. And you generally have 3 pads, one in the front and one on either sides. And, the first, I'd say 24 to 48 hours is critical in making sure your skin is nice and smooth. What's also important after BBL is massages. Okay, there's a lot of swelling that occurs afterwards, so getting lymphatic massages after to try to push out not only the tumescent fluid, which is the fluid we put in during the operation, but all the swelling can be reduced by getting massages soon after the surgery. So what's most important are the faja or the girdle, the lipofoam pad that are under the girdle, and getting lymphatic massages afterwards. All these three things are almost as important as what happens during the surgery. Obviously, you have to come back to see me several times after the operation so I can monitor you and making sure that you have a good outcome. So what do they say? Prevention is worth, it's better to prevent a problem early on than not seeing me and letting it go too long. So also afterwards, it's very important that you not sit on your butt for 2 weeks. So no pressure whatsoever after 2 weeks. Fat cells are very fragile, they're very delicate cells, and any pressure on them can cause not only the fat to resorb or to die, which will cause your butt to shrink, but it can also cause problems with the skin, overlying skin. So it's very important that you not sit on your butt for 2 weeks after the surgery. But besides that, it's a pretty straightforward operation. Like I said, Miami is becoming the epicenter of these BBLs. One of my favorite operations, I do thousands of them. So please, and I think Amalia is a good testament to how good you can look after having this 2-hour procedure. Okay, so I'm just filling them in.
So, doctor, I went off a little bit. So, the BMI. What's your BMI? What's the most important about the BMI?
We're doing liposuction, and the goal of the operation is that you look different. Now, if you're very, very much overweight, and I take out a lot of fat, if you still have a lot of fat left over, it won't really look that much different. So, for a good result, I want to be able to give you a dramatic difference. So, if you're morbidly obese, you have a BMI of like 40, if you're like 260 pounds, 300 pounds, doing a little liposuction is not really going to be that effective. But if you're in a normal rate, I mean, all Americans are slightly overweight, most of them. So, but if your BMI is under 35, then I think you'll have a very dramatic improvement.
So, to be more specific, 35 BMI with Dr. Osako is perfectly fine, and under 35 is even better. So, ladies, if you want to book your next surgery here with Dr. Osako, call us here at Bob Cosmetic Center and book your next surgery. No lo pienses más y llámanos aquí a Bob Cosmetic Center y pon tu próxima cirugía aquí con el doctor. Recuérdese, nuestra primera prioridad es safety y somos Joint Commission accredited. Trabajamos con todas las cosas inspeccionadas, todos nuestros médicos, nuestros salones y todo nuestro equipo está certificado por el Departamento de Salud y estamos en perfectas condiciones, no tenemos ningún problema, todo está bien aquí. So llámanos y pon tu próxima cirugía aquí en Bob Cosmetic Center. Thank you, doctor.
Right. I promise to learn Spanish.
Can you say, ven y pon tu próxima cirugía?
Ven y pronto próxima cirugía.
Aquí conmigo.
Aquí conmigo.
En Bob Cosmetics.
And Bob Cosmetics.
Okay, doctor, so I'm a Spanish patient. Let's say I'm a Spanish patient and I'm not going to speak to you in English, okay? Let's see. I'm going to play, I'm a patient, okay? Hola, doctor, ¿cómo está? You're the doctor. I'm going to play the patient, okay? Hola, doctor, ¿cómo está?
¿Cómo está?
Muy bien, ¿y tú?
Muy bien, gracias.
Doctor, me quiero hacer una cirugía.
¿Qué puedo ayudar?
Me quiero hacer una cirugía.
Sí, I think it's...
I want to do surgery.
I'd be happy to do your surgery.
In Spanish,
In
doctor.
Spanish? I'm on camera. I don't know Spanish.
In Spanish, doctor. Come on. Me quiero hacer una cirugía.
Sí, ¿qué tipo de cirugía?
Me quiero hacer lipo aquí, en la cintura, en las chichas aquí, en la cintura más
pequeña.
Sí.
Estómago plano.
Más, está plana.
Cortita, poquito.
No estoy cortita. I am not fat.
Yeah,
You
no.
clearly me fat.
No, I'm not really fat.
The doctor's just coming back, ladies.
I don't know Spanish, ladies. Okay.
That was good, doctor.
A lot of
That was.
pressure.
So, ladies, thank you, doctor. It's been a pleasure. Well, we're waiting for Amalia to see her with garment and
You
stuff.
want to go check on her?
You can go check on her. Yeah, thank you, doctor.
guys.
You
Bye.
see, the doctor's so nice. He's gonna go check on our patients. So, ladies, once again, we're here at the Cosmetic Center. Book your next surgery here with us. We have amazing doctors, amazing results. We want you happy. Remember, our priority is your safety. We have the pre-op department. We have our nurses. We have the recovery room. We have the doctors here. If you call and you book your surgery, anytime we have the doctor here, you could call FaceTime with the doctor. You can come to a previous consultation with the doctor and he is going to be here waiting for your call. And we do follow-ups after surgery. We'll call you every day for the next 3 months to make sure you're okay. If you have any problems, if you have any complaints, inbox me, text me. My number is up there. You can look for me on YouTube. You can find me on Instagram. You can find me in here at the Cosmetic Center. If not, you can send me a message. We have coordinators behind that phone, behind that Facebook Live. She's answering all the questions. And I get to review every question that you girls ask. So estamos aquí de nuevo en Bob Cosmetic Center. Como vieron anteriormente, estábamos con Amelia, que hace 7 días de su cirugía. Quiero que las personas que me están mirando este video, que no han visto los videos anteriores, que vayan a los videos de Amelia desde el principio que empezó su cirugía, para que vean la transformación, cómo esta niña ha transformado de un día para otro. Ella tiene 20 años, tenía un BMI, no me recuerdo ahorita mismo si era 25, 26, se sentía muy insegura, no quería ponerse ropa, no quería ni ir al colegio. Y desde este journey, yo sé que hay cosas más importantes que hacerse una cirugía, lo tengo muy bien entendido. Hay muchas más prioridades que venir a hacerse una cirugía, pero ¿quiénes somos para decirle a usted lo que usted se necesita hacer? Tiene que hacerse lo que se haga feliz, lo que te haga sientas feliz para levantarte diario, para poner esa sonrisa en tu cara. Lo que te haga feliz, hártelo. No importa quién te diga ni quién te juzgue, harte lo que te haga feliz. Y llámanos, que estamos aquí para ayudarte, para hacerte sentir bien. Y recuerden, nuestra primera prioridad es tu salud y que tú estés bien y que estés safe. I was just telling patients that number 1 priority is their safety.
Yeah,
Number 1.
Yeah, surgery. It's very, it's
That this is not a mandatory surgery. This is something cosmetic.
it's elective. It's by choice, and because it's by choice, we take extra special care to make sure that you have a good result. And welcome back, Mom.
Here's Amalia with the whole garment on.
board.
She has the board. I just see the whole.
Yeah, the
She
board.
needs to wear this for the first 3 months, right, doctor?
Correct, 3
and
months.
the phone's inside. Very important because the doctor Osak right here gets really mad at me when he doesn't see patients with the phone. Ladies, you need to get the phone, because if he gets mad at me, you don't have a right surgery results. You need to have the phones inside. Why is the phone so important, doctor?
Because the garment, although it provides compression, it can be uneven, especially if you're sitting down or bending. It can cause creases that can be transmitted to the skin. So the foam is an added layer of protection, so that if the garment, even the zipper or the snaps from the garment, can make marks in the skin, which you don't want. And these marks can become permanent, especially in the first couple days. So the foam is an added layer of protection to make sure your skin is nice and flat and smooth, and that the garment, although it's necessary, doesn't compromise the results. So it's just an added layer of protection.
So ladies, thank you for watching us. We're going to be later on with more videos live with Amelia. She's going to stay here with us the whole day. So we're going to talk more about her journey, what she's doing, what's her future plans. And I'll see you later. Thank you, doctor, for being here with us.
Thank you so much, Naomi. And Amalia, I think you look absolutely spectacular, amazing. And
This is a great team.
Okay.
Yeah.
Bye.
Bye.
See you
Take care.
later.